All right, I think we're going to get started. So I wanted to welcome everyone to tonight's webinar, Breaking Through the Barriers, Spina Bifida, and Mental Health. My name is Rachel Gallant. I am ISBA's clinical program designer and an occupational therapist by background. I'll be facilitating tonight's presentation. Before we begin, I want to go over just some housekeeping notes. We're recording tonight's presentation to be viewed on demand later on, and to anyone who may have missed it who could benefit from it later. We encourage questions throughout the presentation by putting your questions in the Q&A box as they come up. If you would like to remain anonymous with your question, please check the anonymous box before posting your question. We will try to answer these questions in real time and verbally so that they are captured in the recording. If there are any questions we do not get to, we will send answers out via email as we want to make sure everyone's voices are heard. The chat is disabled for attendees, but we may be sending notices out during the presentation through the chat, so keep an eye out for that. And if you have any questions for me, you can also send those in the Q&A. Thank you all for attending tonight's presentation and being flexible with the changed date and time. We really appreciate your participation and attention to this important topic. Finally, a survey should appear in your browser when the webinar is ended, and please complete that because your feedback is really important to us. So right now, I'd like you to turn your attention now to Kristen Anderson, who will introduce herself and her co-presenters. Take it away, Kristen.
Hi, everyone. I hope you've had a good day. My name's Kristen. If you haven't met me already, either over the phone or in person, I am the social worker for the Illinois Spina Bifida Association. Come December, I will have been in this role for 2 years, and I have really enjoyed it. Prior to my role with the Illinois Spina Bifida Association, I have been a social worker for the Children's Hospital of Illinois, working with kids and adults born with congenital heart defects. And I also have been a home health and hospice social worker in the Peoria area. So I really am excited for you guys to come tonight, and I'll introduce Jamie.
Hi, I'm Jamie, and I have myelomeninger. And I will now introduce my sister, Sarah.
Hello, my name is Sarah Lindenbaum. I'm a librarian and writer by trade. I have generalized anxiety disorder myself, so while I do not have spina bifida, I feel like I can speak with some sort of expertise to the mental health component. And Jamie is my younger brother.
All right, so one of the things that we just want to talk about is the topic of mental health can be difficult. It can trigger us. It can make us nervous. It can make us look about certain things that we have put off or things about ourselves. And so what we want to just remind everyone is that we're all different. We all have our own mental health journey, and no one person has the same. But the bottom line is that we hope that tonight you understand that we at the Illinois Spina Bifida Association, Jamie and Sarah, just want to help raise awareness to this topic, and also just make sure that you know how to reach out to myself or others if you feel like you need more assistance with your mental health. And so some of the things that we're going to discuss tonight, like Rachel said, adults living with spina bifida, but how it impacts our mental health, how the stigma of mental health impacts how we assess care or the barriers in getting to that care, and when it's appropriate to start looking for professional help. And so one of the things that I just want to bring to everyone's attention is just how common mental health issues are with individuals with spina bifida. So when looking into the research, getting ready for this topic, it really honed in that 1 out of 4 adults living with spina bifida experience a mental health concern in this past year. So that could be issues with anxiety, issues with depression, and PTSD, but it's more common in the general public, it's more common in individuals with spina bifida than in the general public. And on the next slide, it will even say that more than 50% of the individuals living with spina bifida meet the diagnostic criteria to have anxiety, depression, or PTSD. And that is double the prevalence that would be found in the general community. So let's talk a little bit about that. So why is mental health such an issue with individuals with spina bifida? And when we think about that, we can break it into 4 topics. And all of these 4 topics go together. When we think about the medical aspects of that, we're looking into the neuropsychology part of the medical aspects, the social difficulties that affect the medical aspects, the physical disabilities, and just in the medical system as a whole. When I say the neuropsych functioning of it, those are the buzz topics that you're hearing a lot within ISBA and within the community, which is the executive functioning aspect as well. So how individuals with spina bifida have attention, how individuals with spina bifida look at problem solving and questions, all of that is still being discovered, and all of that is still being looked at with how we respond to questions. And that's kind of the buzzword right now, which is executive functioning. And because of how individuals with spina bifida respond to these types of questions or problems, that can impact the way that we have attention and the way that it affects our ability to learn, our ability to organize, our ability to, problem solve. And all of that then goes into how we are mentally. And then our physical disabilities, which would be the pain, that individuals with spina bifida go through, the mobility issues that individuals with spina bifida go through. All of that impacts the medical and the physical, can all impact how our life challenges are, how we how those things then filter into the social aspects of it. And when we're dealing with issues that have been brought upon us medically, then that impacts how we want to be socially. So kind of thinking about the first box is now transitioning into the second box. And that can weigh an impact on how we want to interact with others, how we might feel lonely at times because we feel different from others, how those social interactions with our peers feel different because of the challenges that individuals with spina bifida are faced with are different than maybe their peers. And so again, all of those things filter into the next box that then affect our ability for work and our ability for finances. And I feel like right now we're all being a little more strapped for, work seems to be more and more and more and more. And then financial can be harder and harder and harder. And how then that impacts our challenges in life and how we value our self-worth based off of some of the social parts, and then some of the ways that we're able to navigate our financial parts. And it all starts accumulating over this spectrum, and then that starts getting to how we feel about ourselves, and how that transitions into just the whole compass of how the medical, and then how we feel about social, and then how we feel about ourselves can go hand in hand over a long period of time, and then it just impacts our mental health aspect as well. And so the one things that we really kind of honed in on is then how do I navigate this? So we know that there's a higher prevalence. We know that all of these factors go into it, but how do we navigate that system? And so really coming together tonight, and this is what we wanted to spend like the crux of it, to really talk to Jamie and Sarah and then myself, and how, you know, certain parts of the mental health system, how we work through these things together and answer some questions and our thoughts on these processes. So the first question that we came up with is, what kinds of mental health challenges can go along with spina bifida? And so I don't know, Sarah or Jamie, do you want to answer that one first?
Yeah, go ahead, Jamie.
Yeah, I mean, for me, I think for a lot of people with spina bifida, there's a lot of unexpected hurdles that you have to navigate, more so than, you know, others without spina bifida. You have to navigate unexpected physical challenges and mental as well. And for me, that came in the form of, like, you know, hospital stays. And with spina bifida, you're more prone to like bladder conditions, which I suffer from. So I was in and out of doctor's offices most of my life, and surgeries as well.
And just piggybacking on what Jamie says, so the accumulation of all of those experiences, you know, while doctors and medical professionals are trying to solve conditions and problems with your body that you have as a result of spina bifida, they're very much focused on the physical well-being aspect, while these experiences are more likely to contribute to the formation of something like post-traumatic medical post-traumatic stress disorder, which is a thing. You know, people are in hospitals too much. You know, there's pain that goes along with it. There's discomfort. There's the anticipation of pain and discomfort. There's the sort of like othering of your body, where people are talking about your body as if it's a thing and not a person. And I think that can definitely lead to the development of medical PTSD and the attendant conditions like anxiety, depression, and those can come with symptoms like low self-esteem, poor self-image, body image issues. You know, you might feel like you start to dissociate from your body because, you know, people are talking about it as if it's an object and not a person, and kind of to, you know, help you cope with it, you might have these dissociation mechanisms. You know, any other symptoms that go along with anxiety, depression, PTSD, Jamie?
Um, I would say that just about covers it. I mean, and I've gone through all of those things with the physical hurdles that I've had to overcome.
And I think for me, just as a bystander, it did not really occur to me, except within the past couple of years, that, oh, the mental challenges can definitely be comorbid with the physical condition of spina bifida, way more so than as as sorry as Kristen was saying, way more than in the general population. You know, it's I don't want to say it's a given, but it almost in a certain way, you know, looking at it objectively, it almost seems like it would be inevitable, right? You know, you go through these terribly challenging physical things, not just with the hospitalization, but you're at home, you're recovering, you're also, you know, adapting mobility wise to different things. And, you know, I don't want to speak for Jamie, but for example, his mobility has changed throughout his life. He has walked with the aid of braces as a young child. He walked later than most kids, but he was able to walk with braces. But then he had a lot of surgeries, which put him in full body casts, put him in wheelchairs. Now he walks with crutches because he has a different gait because of the, you know, the surgeries. So, you know, just navigating sort of like the mental ups and downs of that. You know, I could do this, but now I've got to do this. And, you know, is it temporary? Is it permanent? That, you know, that kind of thing.
And I think so often, like Sarah mentioned, you know, the healthcare system can be so focused on the temporary fixes of the symptoms of the here and now. I don't know about your healthcare provider, but my primary care office has gotten to the point where I'm only supposed to talk about the thing that I asked the doctor's appointment for. You know, I'm not supposed to talk about any other symptom that I've been having that could have led up to the other symptoms that I'm experiencing now. And so often somebody living with spina bifida, living with a long-term chronic illness, there's so many other factors that are compounded into why we might be in pain, why we might be experiencing things. And the medical system as a whole is getting away from that, you know, that, the complex care system, or multiple disciplinary teams, and just putting a quick fix on certain parts. And that's a big challenge right now for individuals living with spina bifida, to feel like they're being heard for their medical stuff, but also the mental health aspect that goes into that. And it also can, there's a big issue that I talk to a lot of the individuals living with spina bifida about just the sense of, the changes in like pride or dignity, to have to talk about some of the challenges and barriers when you're talking about catheterizations and constipation and all of these things that make it difficult. And if you don't feel like you can talk to your doctor's office about all that physical stuff, how does that impact you mentally? And how do you feel like you're being heard at the doctor's office can be a huge issue as well.
And piggybacking on that too, I think as Kristen was saying, the health system is so compartmentalized. You have your nephrologist, you might have a neurologist, you might have a physical therapist, you might have a primary care physician. But if you're only going there for, say, the complaints of bladder issues, are they really going to do the mental health screening where they're like, how many days have you felt depressed, in the past week, that type of stuff? And it doesn't seem like there's a holistic approach to things, especially when you are having physical health crises and the focus is on, let's triage the thing that, may be putting your life in immediate danger or could lead to, a worse condition. Let's tackle that. The focus, like the mental health stuff just goes way on the back burner, I feel like. And, along with the mental health challenges, like you were talking about in the beginning of the presentation, Kristen, it's all of a piece, all of these aspects of your life, whether it's your career path or your social life, they all kind of tie into spina bifida, the physical challenges that come with it, but also the mental challenges. And so, you might be feeling, you might be feeling social isolation because you feel like you're different, or you feel like you might be perceived as different. you might be facing bullying from peers, and that's more likely to lead to the development of depression, anxiety, PTSD, other things. And, it's just the impacts of it, I think, can be pretty far reaching. It's not as if this is something that sort of stays in its lane and you only have it when you're at home. It sort of sends its tendrils into all the other aspects of your life. Do you have anything to add to that, Jamie?
I think you put it better than I could have.
So do we, oh, go ahead, Kristen.
Oh, and I think that's kind of an awesome thing to, hear Jamie say too. It's like, I will say sometimes the challenges, and I just applaud you, Sarah, because I think, in our own family structure too, sometimes individuals that have dealt with a long-term chronic illness, spina bifida, you know, we don't always tell our family all of the, mental symptoms. The physical symptoms are something that people can see, and they're something that can be described differently, and but the mental challenges that also come along with spina bifida are being able to talk to our families about it, being able to talk to our doctors about it. And Sarah, I just applaud you for just being in tune to your brother, and just others, and being aware of the challenges that may come up too.
Yeah. It's not something we really talk about openly, but it's something I've obviously thought about a lot, and maybe we should talk about more openly. But I mean, I think that's a pretty good segue into the next slide, which is why, if you're having these mental health challenges, why might you not reach out? Do you want to kick us off, Jamie?
Yeah, I mean, for me, growing up physically handicapped, I think people tend to want to, for lack of better words, baby you, and sort of do things for you that you could do for yourself. So early on, I sort of developed a trait where I didn't want to ask for help. I wanted to be as independent as possible. I thought I could handle everything myself. I thought I could improvise. And in reality, it's just not that simple. And I think, when you develop that trait, there's also anxiety that develops that can impact your ability to seek help as well. And, it's also, in general, just difficult to know where to start with seeking help.
Just further to what Jamie is saying there, I think there could be too a tendency to, if you feel like, I'm trying to think of a better word than burden, but if you feel like the people in your lives are spending a lot of their time and energy around your physical condition and helping you get to doctor's appointments and helping you with medical care and whatnot, there may be the reluctance, or there may be the tendency to think, well, I can solve the mental aspect on my own, one. And I think, and here's where I'm talking from my personal experience, as far back as I can remember, I had symptoms of generalized anxiety disorder, age 4. Why? I don't know. I can't think of any like small, capital T trauma or even lowercase t trauma that happened then. I had it. And that tendency does run in my family. All three of my siblings have generalized anxiety disorder. One of my parents does. So I think there's probably a hereditary aspect. But if you can believe it, even though I had just absolutely terrible anxiety from age 10 to 13, and then it kind of ebbed and flowed in my teens. I had depression when I was 17. Um, I did not realize I had anxiety until my early 20s. I just didn't have the language for it. Nobody really screened me for it. That's the other thing. Like if you're in a family where like one of the members has a serious medical condition, there may not be the awareness of like mental health symptoms in some of the other kids too. And I think that could certainly impact somebody who has spina bifida as well. If you sort of not mask the symptoms, but if you're experiencing the symptoms and you normalize it as, well, this is just the way I am, I've kind of just always had these quirks or these peculiarities. I've lived with them my whole life. I'll continue living with them. You don't maybe stop to think, is this something that quote unquote normal or neurotypical people experience, just sort of becomes part of your personality. Well, I'm weird about open spaces, or I don't really want to go out in public today, or I'm feeling a lot of anxiety about this upcoming doctor's appointment, but it's all a part of who I am, and that's the other thing too, like because I think you also might just want a break from being seen as the person with the condition, and so you kind of mask the anxiety. And I know that people with other mental health conditions, whether they're anxiety or some kind of personality disorder or depression, it sometimes feels good just to not reveal that stuff and just to sort of pass as normal. I'm pretty open about having anxiety, but it's still not something that I bring up in day-to-day conversation because I can pass as somebody who like didn't take 8.5 years to get through my undergrad degree because my anxiety was so crippling. You know what I mean?
I think too that just is a big part as the society's view to label individuals as well, kind of exactly what Sarah said. So often individuals, you know, they like we talked about the physical aspects, and how we feel we get labeled, with some of our physical attributes. And then when you're feeling all that pressure to have people help you with this and help you with that and help you with that. And then, okay, so now I need to, if I ask for help with this, then I'm going to get labeled as needing that help too. And, and I really think that what Jamie mentioned in the beginning is wanting some type of autonomy and wanting to be able to navigate something on your own and have some type of control. When everything physically is being told to you by doctors, well, we have to do this and you have to take these meds and you have to do this and you have to do that. Like it can be overwhelming to be like, well, I also don't want to, like I also don't feel good about, like getting out of bed, or I just want to sleep more. And so I think we start minimizing some of those things that might be considered anxiety or might be considered signs of depression because we're so focused on the physical aspects, because that's been such a forefront and center for the majority of our childhood, the majority of our lives. And so I think it gets put on the back burner a lot as well.
Also, just because of sheer burnout,
Mhm.
if you're sort of carrying the mental load of going to all these doctor's appointments, undergoing surgeries, undergoing procedures, you might just want a damn break.
Mhm.
You might like just not have the bandwidth to say, look, I'm struggling mentally because in your life you've carved out a safe cocoon for yourself to go into when you're feeling bad. And, as long as you sort of have that, it's just easier to let the mental aspect go, because you're
Mhm.
dealing with so much else, in your life. And it just, it, I mean, again, just speaking from observation, it seems like it takes a tremendous amount of just emotional fortitude to handle that, you know?
And I would say again, speaking from observation, when talking to individuals with spina bifida over the last year and a half with this job, so much of my job is trying to help them find a doctor that will listen, or find a doctor that still cares, or find a doctor that will think about my constipation and not just try to throw more medicine at me, that there has to be something more available out there. And when you get to the point where you feel like the system is failing you physically, do you even have the energy to say, well, I also need to work on this too, because you don't feel like the system's going to help you. And again, it creates more of the stuff that we've talked about earlier, the isolation, more anxiety, more fear. And, when you don't feel like you're being heard in other aspects of your life, you just don't have the bandwidth, like Sarah was saying, to put effort into that part of your life as well.
And it does take effort, you know, somebody who's
Mhm.
in therapy, myself, even though I know it's good for me and I feel good after I do it, I'm just like on once a month maintenance therapy. You know, it's just like, I don't really want to drag out of the house today. And do I really feel like having tough conversations today? Not really. And just one other point I wanted to add to this question of what are the reasons someone with spina bifida might not seek out help for mental health challenges is whether you have a quote unquote disability or not, whether you have spina bifida or not, there's still a stigma about mental health.
Mhm.
It's why do you need to see a shrink? Are you crazy too? In addition to having spina bifida, you know, there's still, you know, and I try to moderate my own language, but we use like just collectively as a society, we use the word crazy to describe a lot of things. There are, you know, and maybe we shouldn't because it's you know, it's stigmatizing something that's really, really common and affects a lot of people, whether they have spina bifida, whether they have another physical condition, or whether they weren't born with a congenital condition. It's just, it's almost universal to have some kind of mental health issue or not maybe at all the times during your life, you know, it can just be, you know, in response to a stressful or traumatic event or something like that. But even so, I think there's still this stigma of, well, I'm not, you know, therapy is for really broken people. I'm not really broken. Here are all these people worse off than me, you know, and I'm not, you know, so I think there's just the stigma. There's the wider societal stigma that just makes it hard to talk about mental health and to think about mental health.
I would agree. And the last thing I would talk about is just to have, the support system involved in that. And that might be transportation, that might be, families, to help you get to these appointments. It might be insurance to get you coverage for these types of things. And so there could be barriers as well. And just to pinpoint my role here again with ISBA, if some of those things are reasons why you're not seeking mental health assistance, or why someone in your family might not, please reach out to me, because if it is a barrier as far as like a support system or transportation or insurance, I would be happy to assist in that as well. And
Mm.
so we could go to the next
Yeah, I
question.
was going to say, I think that takes us to the next slide. Did
Yeah.
you have anything to add to the last slide, Jamie?
I think it was pretty well covered.
Okay.
So the next question is, if they do seek help, or if they're trying to seek help, what are some of the barriers they might face?
Um, Again, I would say there's that mental barrier, that anxiety of, you know, not knowing where to start. The American healthcare system isn't the easiest thing to navigate, and to find proper resources just on your own is not the easiest thing to do.
And you also just might not know that there are resources like the Illinois Spina Bifida Association too, if you're not, an involved
Exactly.
member.
Yeah. And insurance is hard. I mean, I'm a social worker in the medical world, and I still don't even understand some of the issues with the way that insurance is shifting, whether it be a prior authorization, whether it be a peer-to-peer review from a doctor to a doctor. There's so
Mhm.
many aspects that are changing the insurance world and the medical world. And again, if you feel like that, you would like to seek mental health resources, but you feel like you've come against a barrier, whether it be insurance or transportation or something like that, I would be happy to help navigate that system for you and try to find a counselor or someone in your area that would help you with that.
And just speaking generally to, barriers that somebody might face, I'm sure we've all seen the news stories that there is just a deficit of mental health care providers. There has been for a long time. It's hard to find somebody, even if you're being proactive, and that can be discouraging. I want to reach out for help. Oh, wait, I can't find anybody, especially if you're living in a more rural area where you might not be near a large medical provider like OSF or Carl or HSHS or DMH or something like that. Um, yeah. And also to the insurance question, if you're on if you're on state aid or Medicaid, Medicaid is notorious for only, they only have certain providers within their system, so are those providers going to have greater wait times than if you had private insurance? I mean, you can probably speak to that better, Kristen, but that's another potential
Yeah.
barrier.
So, and that, I was just gonna hone in on that too. We all have personality differences, and when you're talking about your mental health, if the individual that you are trying to speak with about these things is not somebody you feel comfortable with because it's the first person you seek, or it's because who your
Mhm.
insurance sent you to, that can become a barrier within the mental health community. And sometimes we might not feel comfortable talking to those types of people that make you feel uncomfortable, or it can honestly just be the tone in their voice, that just is like, I'm just not
Yeah.
feeling this. And so, um, a lot more mental health providers right now are being very open and honest on whether or not they're accepting new patients. And because of Zoom, there can be easier options to find individuals that might not be locally. And so that could reduce the transportation barrier as well. But then you have to have access to internet, or, those types of avenues, or a laptop, or a tablet or a smartphone. And so again, navigating that system to go over that hurdle. And again, when you're feeling low, you just don't have the energy to put forth, figuring out all of those avenues to get yourself to that point. And so that can usually stop people right in their tracks, because it's not an easy system to navigate. And so, however I can be of an assistance for that, I'd be happy to. But right now, there are mental health providers available. And so just getting you connected. And if there is a lot, like if the one that I would recommend is a long wait time, I can hopefully find you one that might be over a Zoom period of time before we can get you connected to an in-person one, if that's what you would prefer.
And
Anything else? Oh, yeah.
building on to what you were saying, I mean, I probably went through, I think, 5 different counselors before I found one that I felt connected with me and understood me.
Mhm.
And, just going through that process of, trying to find someone like that is, you know, it's a financial burden, but also, a mental burden. You get burned out, just trying to find a good counselor.
Mhm. And that's a scary thing too, because the patient gets burned out, but they can come across a counselor that's burnt out too. And that's a really scary thing for individuals dealing with a mental health crisis can be faced with. And that's a scary thing right now with our society, because mental health counselors can be limited. And I'm not trying to scare anyone from not seeking help, but again, reaching, like if I would have been able to be helping Jamie in the first place and telling him, that can be common, that person can be burnt out, they shouldn't have said those things, like that. Your response to not feeling comfortable with them is a human response, and we just need to keep trying. Just by someone being able to validate that feeling as well in that moment would have helped Jamie I mean, I'm grateful for whatever support system he had in that moment to keep trying and make it a priority for him. But there might be people out there that just say, I just can't do this anymore. Like I don't have the energy. I'm too focused on having the energy to go to my urologist and deal with my wounds and try to figure out how I'm going to put food on the table and things like that. And so it can become a back burner. But just do know that that can be an issue, and we'd be happy to help you continue to find the person that is the right fit.
And just one last thing to add on to that, I think we may have all heard before with regard to taking medication if you have a mental health condition. Like it sometimes takes time to find the right medication. You might not respond to the first several medications they try you on, but you've just got to keep trying and trying and trying. We've heard that, but I don't think we hear as often. It's okay to it's okay to have that same trial and error with counselors or therapists. You may not gel with the first person, even the second person, maybe not even the third person that you try. It's everyone's an individual, which means your body's going to react differently to medication, but also your personality is just not necessarily going to click with another person's personality to where you feel comfortable enough to be vulnerable with them and to trust them with hard topics.
I was gonna say it's kind of like you can think of it as dating and finding your right your right fit. And also just to touch on what Kristen said, one of the barriers I feel that COVID sort of took away was that people can do therapy over Zoom or virtually, and so that can take away the barrier of transportation, and that it can
Yeah.
be, as long as you have all the resources with internet and devices, it can be an easier way to, not feel like you have to get all the way there, but just log in.
And I will say that each individual can completely feel more comfortable. Some people need to be in a different space and have that moment, but they've actually done a lot of research, not to push Zoom or anything on anyone, but they've actually done a lot of research that people have become more comfortable in their own space sharing what's going on. They don't feel as intimidated by the space around them or the environment, and sometimes you're even able to have your emotional support pet or some things that provide you comfort. And so you might be more open to share. So even if it doesn't sound like, if that's been a barrier because you don't have transportation and you don't know if you could connect with someone via Zoom through a counselor, you and I could talk about that too. And it has been something that has come out that can be more comforting. But again, if in person would be what you feel would be best for you, we can definitely work on finding you that as well. And then one more thing, and we do have to move to the next question because we're on a time limit, but the other part might be the amount of paperwork that they send you that you're supposed to fill out in order to even just go to the counselor. And that, kind of bringing back those original things that we talked about, those neuro executive functioning things, if that amount of paperwork that the office sent you that they just want you to fill out is just the first barrier that you come against. Again, how I can help you with that, and how I can work through that paperwork with you, or find someone locally that can help you fill out that paperwork, let me know, because I have found with some of our patients that can be the first barrier that they come across, and they just stop after that. So just trying to think of things that might stop you in your tracks, and how we ISBA can help you move forward as well. So the next slide would be our last question, I think. So what are some of the downsides of not seeking help? And Jamie, do you want to start this one off too?
Sure. I mean, there's really no upside to not seeking help. The more that you put off your mental health, the worse you're going to get, because, as you progress through life, those physical and mental challenges that you face as someone with spina bifida continue to pile up. And, it could just get to be too much. So I think the earlier that you could be proactive, the better. Because I myself have delayed before seeking help, and it's affected me physically and mentally.
Yeah, I think, humans are resilient, and people with spina bifida are especially resilient. And if you are not addressing your mental health, I think there's a tendency for you to just come up with your own coping strategies. And some of those, can be maladaptive. Some of them can be less harmless. Some of them could be really, really harmful, like drinking, drug use, and self-harm. Although when I was doing research for this webinar, I did find studies that showed that people with spina bifida don't use substance abuse as a coping mechanism as much as the general population, which is a very good thing. But maladaptive coping strategies don't have to be substance abuse. They could be, avoidance, escapism, numbing behaviors, just and when you're coming up with your own strategies to deal with mental illness and letting problems go sort of unchecked for years, maybe even decades, it's just going to become harder to break those patterns and get out of the groove if you have your own little ways of, sort of making yourself feel better.
I would just kind of piggyback on both of those and just say, as we've talked about, and as individuals with spina bifida know, we only face more challenges as physically as we get older, and being able to address all of those physical challenges that might come up with our best mental self. And so being, Sarah and Jamie really touched on a lot of the things I would have talked about, but how we can best be able to approach everything physically when we're at our best mentally as well. Because the physical stuff can be really hard and really heavy. And when you've put your mental self on the back burner, then it just becomes compounded, and it's hard to even feel like you want to even deal with the physical stuff because it's just too much.
And the downside is also the big picture, right?
Mm-hmm.
Whether your goal is whether your goals are educational in nature or social, or and like involve independent living, or they don't, or even if your goals are simple, like maybe I want to volunteer once a month, or maybe I want to pick up a new hobby at home. If you're not addressing the mental health thing that can be a huge impediment to you sort of reaching your full potential as a person. And I don't mean full potential as in, getting 3 PhDs or becoming the next Picasso, but just, whatever goals or purpose you think your life might have, that can be hindered if, you're just feeling cruddy because, you have an unaddressed mental health issue.
And I, again, too, just going back on how, that whole everything is the human body. So how we are physically, and, I just think about individuals, when um, that suffer from depression and don't want to get out of bed, and how that would affect an individual with spina bifida and wounds and pain and things like that. And those are all encompassing. And so, how we address our mental health and how that affects us physically go hand in hand as well.
Yeah.
And so the next slide, I don't, unless is really, reminding ourselves this stuff was heavy, and it might have brought up things like, I really need to work on that, but I don't know how to start. And just working with, connecting individuals with others and acknowledging our feelings. And I should have put a slide. I just thought of, how things go through your head and stuff, but really giving credit to ISBA too, throughout the years, on how they've added transition programs and how they've fought to have a social worker on board, and how they're working with getting executive functioning coaching, and things that all are looking at the individual as a whole, and how all of those pieces impact our mental health, and how we can help you guys navigate certain systems, and hopefully feel like you can reach out to us sooner, and maybe, pick up more along the way too, where you feel like you are being supported as well. So whether it be connecting with staff at ISBA or connecting with others with spina bifida, or your family, or the medical system, just let us know. And then, of course, just as a licensed professional, and just an individual that cares, is just that if you ever feel like that you are feeling that you need immediate assistance where you could harm yourself or harm another, please seek by calling 988. It's a newer mental health crisis line, or 911, or go to your nearest emergency room to be evaluated as well. And then, of course, the last slide is, don't ever hesitate to help. The very first slide has my direct phone number on it through ISBA, and I would be happy to just start that process of talking to you, and figuring out where you feel like you're at mentally, and where your mental health is, and then working with, getting you connected to the appropriate resources, or working through any barriers that are happening that are keeping you from getting connected to any mental health resources. Jamie or Sarah, do you have anything else you'd want to add to that?
It's never too late, even if you feel like, crap, I'm in my 20s, I'm in my 30s, I'm in my 40s, I'm in my 50s, I'm in, and so on, and I still haven't addressed this, you still can. It'll be worth it for sure.
Yeah. I'm working with someone that is a dear person to me right now, and has known my line of work for 15 years, and has really been struggling with understanding her thought processes at times, and understanding how she reacts and feels about things, and coming to her realization that she suffers from anxiety, and really helping her. She's known me almost my entire life, and just having a hard, she's in her 40s and she's having a hard time understanding and accepting that. But she, it, like Sarah said, it's never too late to, work with individuals or to just start that process.
And also just, a final thought of don't underestimate just how much little steps can add up. Just doing small self-care things, or just doing little steps as well. If I want to get signed up with a therapist, you may feel like I've got to find somebody next week or it's going to be a bust. But, maybe a small step toward that is just taking 20 minutes, reaching out through the ISBA or Googling therapists in your area, just taking 15 or 20 minutes, and then maybe the next day or the next week, moving on to the next step. It doesn't have to be these huge sweeping changes. It can just be little incremental things that kind of get you on a path toward feeling mentally better. And it's a journey too. It's not going to be you seek out help and suddenly, you don't have these issues, or these issues become necessarily easier, but, just gradually, I think the trajectory will kind of be upward, and there can be peaks and troughs, but if you just kind of stay the course and do these little things, it can really pay off. Jamie, anything?
Uh, yeah, I mean, I would just second what you say and, encourage people not to give up if, you run into barriers with seeking help. Because there are really good sources out there like the ISBA that are there to help and very glad to help.
Thank you. I think we'll leave it with that. Well, I just want to thank